All right, Shelley, any housekeeping items for us?
Just please be aware and advised that we're going to record this meeting and post it to our website. So anything shared via camera, phone, or in the chat is subject to that. That's it.
Thank you. All right, thanks everyone for hopping on. So first, if there's anyone who called in whose name isn't going to show up on the attendance, can you let me know so that I can add you to our attendance so you get added to the minutes? So is there anyone who called in that's also logged in? Amanda, you have your hand raised? Okay. All right, so we'll go ahead and get started. So first, I just want to, I've kind of restructured how I go through things, just because I had a request because not everyone uses the ESO patient registry. So I've kind of started with items that are applicable for everyone, and then towards the end will be things that are more geared towards people who use the registry, just so those of you who don't use the patient registry, you don't have to sit through the whole meeting. So I'll kind of let you know when we get to that point. So yeah, so minutes from our last meeting, we talked about dog bites and them being classified as blunt. And it was shared that TQIP has like a mechanism list that says basically any bite from dog bite to squirrel bite is considered penetrating. I took that back to my team, and we are going to still, for the state, consider dog bites as blunt. The TQIP list is a recommendation. It's not like it's written into stone. And we just feel like that helps paint a better picture of when we capture penetrating injuries, we're not looking for dog bites. We're looking for gunshot wounds, stabbings, things like that. So that will continue to be blunt as far as the state's concerned. So any questions on that? Yeah, just moving forward. Don't go back and change things. So yeah, just moving forward, that'll continue to be the state's stance. Okay. Next data submission is due January 2nd. Please make sure and submit data by the due date. You can expect email reminders. I've scheduled them so that even though I won't be here, you'll get reminders from an email that say send your data in on time. And I'll go over this a little later, but I will be on maternity leave for January 2nd's due date. So it'll be a little bit different. So you will still send in your data submission forms. You're going to email them to Ann Vosbrink. She's one of my phenomenal coworkers. So basically you're just going to fill it out the same way you always have, and then you'll send it to her. And she's going to basically just acknowledge you and say, thanks for sending it in, got it. But then from there, she's not going to do any like validations or anything really with the registry. I will do that. I should be back first or second week of January. So I'll be back shortly after that due date for the data submission. So once I get back, then I'll go through and confirm volume and validate and things like that. And then I'll sign the forms and send them back to you. So that's what you can expect for your the next data submission. Any questions on that? Brian.
In regards to the Q2, if there was any issues on all of that, then we would have heard back. Is that correct?
Yeah, so if you emailed me and I've checked in the repository, and you've gotten a little green check mark in the repository side, then you're good for now. A lot of you, we'll talk about this later, but a lot of you probably noticed there's lots of like warning flags that don't make sense. So we're not going to worry about those for now, just because a lot of them don't make sense. And so I'm working with ESO so they can take away, I mean, some of you have 20,000 warning flags, which is they're not all right. And so we're just going to focus on the error part, and I'll go over that in more detail later. But yes, so for second quarter, if you've heard back from me and I've said I see your data in the repository, then you're good to go.
Copy that. Thank you.
Great. Okay. Okay, so isolated femoral neck fractures, everyone's favorite. We've talked about this numerous times since I've been in this position. As you all know, our inclusion criteria is a little vague as to what to exclude. So in the past, there have been versions of the inclusion criteria that lay out very specifically this code, this code, this code need to exclude. That changed in 2012-ish, I forget which version, but those codes were taken out. Previously, we've kind of shared that old version saying use this for reference, but we have a new document, and I'll caveat this with, even though this isn't written out in the inclusion criteria, this is just to be used for reference, and the purpose of it is so that we can have better data quality as far as our femoral neck fractures go. So the team at Banner put together this little PDF that I want to share, and I've gotten approval for that from them to use it, just because everything that they've added is copacetic with the state's view. So let me go ahead and share that. So the only difference that you'll probably see is that there are references to AIS codes in here. And so what you'll do is you'll look, did the patient arrive POV, EMS, similar to other kind of diagrams with inclusion criteria, but it gives you these references to look for AIS or ICD-10 codes as far as the diagnosis codes. So if they have one of these codes, then you can go, okay, was their mechanism code one of these codes? Because remember, if they're in a car crash and they have an isolated femoral neck fracture, it still goes in their registry. But if they have a same level fall and they have an isolated femoral neck fracture, doesn't go in the registry. So you kind of have to look at both of these codes to see if that patient should go in the registry. And then also on top of that, you need to see if they have any additional injuries. And if no, the patient does not meet inclusion criteria. So I think this will be helpful to have these AIS and ICD-10 codes as well as these mechanism codes laid out for you guys, so we're all on the same page and we'll have a little bit more reliable isolated femoral neck fracture data. So thank you to the Banner team for putting this together. Any questions? Cool. I will be sending this out with the minutes so you guys can have it as a reference sheet to look at. So, all right, let's share this instead. Okay. So a new year is coming up and I have an updated data dictionary. And we've talked about this in past meetings, just with having the new patient registry of what the data dictionary will look like. I talked to my team and I'm going to show you what we kind of decided on, only because, let me share it and it'll make more sense. Okay. All right, so an example here is, let's make sure you guys can see the right page. Yep. Okay, so all that I didn't change the definition because the definitions stay the same, and I didn't change the name up top. And that's because all of our historical data is going to have this name, and it's mapped. Any data from whether it's the ESO patient registry or if any of you have a different registry, when it's mapped over to the repository, this is the name that the state sees. So for reference, I've added down here what the name is for what it looks like in the ESO patient registry. So this one is the same, so not a great example. Let's find one that's different. Okay, so this one we call injury incident time, but if you're looking for it in the ESO patient registry, it's just incident time. So I think this will be helpful going forward. And then if we have hospitals that use different registries, we can add on and say these are the different names according to the different registries that then map over to the state name, which stays the same. So that's how I've added in the changes for the patient registry. And then as far as any updates for 2026, there weren't very many. If any of you have seen the NTDB updates, the only things that were changed were the hospital events. They added unplanned return to the OR and retired unplanned visit to the OR. So a very small change, but that's added in. And then I just noted that we added in the patient registry field name to each of those, each of the fields. And then I wanted to also note, so if you use, and I know I said I'll talk about the ESO patient registry after, this just kind of wove itself in, but if you have the ESO patient registry and you're a full data set, you may have noticed that the e-scooter and e-bike pick list options for position and vehicle there for their original pick list, those are going to be added into the 2026 template when you have that update. Okay. Any questions on that? And I'll attach the updated 2026 full and reduced data dictionaries in the minutes. Okay. So this is also kind of a change. Someone brought up that there was still the other pick list option for comorbid conditions. And it didn't really make sense. So the definition essentially said, if there were any other comorbid conditions, you could select other and use that. Not very helpful, especially as far as the state's concerned, because other could be anything from a broken pinky to insert whatever you want here. So we went ahead and retired other, and just because if you're tracking anything specifically for your site, it's better done in PI or other areas where you can have more detail of what you're tracking instead of just looking at other and kind of hoping for the best. So you'll notice that in the 2026 data dictionary, the other option for comorbids, it has been retired. Okay, so a topic that someone had suggested for TRUG was going over how different sites do their trauma registrar workflow. So I've asked a couple of sites to kind of talk about how they have their workflow as far as you gather your charts and just break it up. And so if there's any helpful data, I know people are just kind of looking for ideas of effective ways of getting their work done. So first, I'll go ahead and turn the time over to Jen from Chandler and let her share what their workflow is. Thank you, Jen. I think Jen's on. Let's check. Pretty sure. Yeah. Do you need to share your screen? Let's see. Jen, are you on? Let's check. Yep. Oh, there you go. You're on mute. Okay. Yeah, if you're talking, you're on mute. We can't hear you. I think we may be having some audio issues. All right, I think I'll turn it over to Maria while we figure out Jen's audio issues. Maria, are you ready to share? Okay, yeah, we'll give you a minute and then we'll let Maria go first.
Can you hear me?
Yep.
Okay. So our workflow at Deer Valley. So one of our registrars, Luis, does a monthly calendar and we just rotate. So we just go, based on the calendar. So it's like Maria, Luis, Olivia, Diana, and then we just rotate again, so it's fair to everyone. And then how do we collect the patients? We run a couple reports in Epic. So we have one for activations like your 1s and 2s or yellow, red. And then we have another report to capture the consults anytime trauma is consulted for any patients. And then we also go over the 24-hour, all the patients that come to the ED and just go through and see if we missed any patient. And then we also run the direct admission in case we had a patient that went straight to the floor. And our last resource is we run the surgeon list daily to make sure there's, a patient that maybe they got consulted 3 days later after the patient arrived to the hospital. So then after we find...
Sorry, Maria, real quick. So just for everyone else's maybe it'll be helpful. Did you build those reports in Epic, or were they already there, or did you have IT build them? So if anyone else doesn't have those types of reports, how did you go about getting those reports?
Epic IT did a couple of them for us, and then I put a request for the consult because sometimes it was hard to find, the consult. So every time the ED doctor wants to talk to a trauma surgeon for a consult, it gets populated when the secretary puts the consult in. It goes into a report in Epic.
Okay, cool, great, thank you.
And then after we find our patients, we enter them in ESO, and we also do the trauma charges. And then after that, our goal is to close our patients. So like right now we're working on our September. So we kind of have like a due date that we try to finish our charts for like September. So it would be on the 15th, our goal to have all the patients that were discharged and our minis done. And when I'm saying minis, maybe patients that are still in house, we don't do the procedures, but we try to do everything else for our TPM so she can run reports for her trauma operations and she can have all the information that she needs. And then, what else? We also go to rounds. So we go to handoff, we take turns. So like I go Tuesdays, like Olivia goes Monday. So we go with our PI nurse to try to capture complications and help her, or in case we want to hear things about our patients, when there's chronic injuries that we don't need to code, or we have questions for the surgeon. So we all take turns, and then we just come and tell whoever, like if it's Olivia's patient, I tell her, if it's her patient, things that I hear. What else? Financials. Now that we have to enter financials manually, so what we do here, every Tuesday, we usually come 2 days to the office. So every Tuesday, everybody comes, all the registrars, and we divide the financials between all of us, and then we have a week to do them. So we do them weekly. It's easier for us. And I think that's it. I don't know if you have a question about something else that maybe I missed.
No, that was great. Thank you. Does anyone have any questions for Maria? Okay, awesome. Thank you, Maria. Jen, did we get your audio working?
I think so. Do you hear me?
Perfect. Yep, got it. Thank you.
Okay. So kind of to echo a lot of what Maria said, I guess I would say first and foremost, the most important helpful thing is that informatics sends me a day via email the hospital census every day, because then I can sort through that and identify the trauma registry patients, patients with an injury who may not be a trauma activation, because I can easily find those based on the flow sheets. There's an ED log that we can cross-check. So, I guess if facilities aren't working with informatics or somebody on the team who can give you that hospital census, I would highly encourage you to do that, because then you're going to have, it's everybody who steps foot in the hospital that day. So there's a lot of things you don't need, but at least you have that list to review. And so we are using Google Workspace here at Chandler. And so I have monthly Google Sheets that basically are tracking all of the info of our registry patients. And I use that for several purposes. One, I use that kind of master list to distribute charts to the registry team. Also, at the end of a month, once all of the patients are in the registry, I use it to cross-check our data and our stats. And it's possible that I've made a mistake on that list. So, but that's what the cross-check is for, to see, what's going on there. But you kind of have a monthly accounting that way. And I actually, because it's a Google Sheet, I'm able to share that real time with the trauma program manager, with the PI team, even our pre-hospital coordinator. I share it with him in case he's looking to give some feedback to an EMS agency on one of our trauma patients. As far as dividing up work, so here at Chandler, I'm the trauma registry supervisor. So I am a registrar and I enter charts, but also I'm the one who's maintaining this master list. And so assigning the charts to registrars, you know, for every facility, it's going to depend how concurrent you are. Ideally, you know, if you're 2 to 3 weeks out, this allows us, so every day I'm updating this list. So, you know, people are working kind of retrospectively leading up to this, but I can divvy up like the first half of a month. So I, you know, just kind of based on your, you know, volume and your staffing and, you know, just kind of make sure everybody gets a fair share of, you know, whether it's activations or ED discharges or whatnot. And sometimes you can't tell at a glance how complex a chart is. So do your best to, you know, then you can chunk out the last half of the month. And if you're extra concurrent, you might have a few stragglers at the end of the month to divvy out to people. But the other thing, 2 things that have been super helpful for us. Every month we have chart entry due dates. And it's kind of what Maria said. Our upcoming chart due date is going to be October 17th for all of the September charts. So again, you know, looking maybe at like a yearly calendar that's broken out by month, and you know, you can plan ahead and see what all your due dates are going to be, and you can work around if you've got activities or events or holidays or things, but to stay on track. And then you're, you know, all the registrars know kind of what to expect when the due dates are. The thing that goes along with that has been, and I think my team would probably agree, the most helpful is we set expectations for what order those charts need to be entered in the registry. So when you receive your list of charts, they must be abstracted according to our hierarchy. And so that would be on your list, any death or dispo to hospice has to go in there first. And then if you see any transfers out, then if you see any complex charts with comps. So the thing that goes into this is when each registrar receives their list of charts, they actually need to look through this and preview this list so they know what they're working with. And, you know, we started this about, a year and a half, 2 years ago, where we said, this is the order we want things. And I think, you know, it was definitely a change because people were just maybe entering chronologically based on their list. But the reason for this is because then we're getting it so people can, first of all, strategize and have better time management because you know how many complex charts you have, or you know what the length of stay is on some of your patients. Maybe you have a quick chart. Maybe somebody was here for 37 days. Also, you're entering those charts that need to be reviewed by PI first. And so that's getting all of that information to the PI team in a timely manner because they need that for their own primary PI review that they just do here, you know, between themselves in the office. And then, you know, secondary review in case anything has to be taken to the trauma medical director. And then if something might be going to, you know, your peer review meeting or something like that. So establishing this hierarchy of chart entry was super helpful. And, you know, then the very last thing would be, of course, your ED discharges, because those are pretty quick and easy. Now, to be fair, you know, I tell people, like, if you just need a brain break, sure, sprinkle in an ED discharge here or there, but really we want them entered in that particular order. And so, you know, that was super helpful in identifying early on any of those hospital events that PI needs to look at. I'm on site, but all of the Chandler trauma registrars work remote. So our PI team actually goes to daily sign out, so doing the rounds, and they keep their own PI tracker. And again, that kind of works for a nice cross check because they might hear something at sign out and they put a note on their list. And sometimes, and we all know this, like sometimes it's for real, sometimes it's not. So they wait to see if a registrar sends an email, they've abstracted a chart and, hey, yeah, I found this in here. Or if not, then they might go back in and look at that. And so that's another nice cross check. But that, you know, that kind of sums it up. I don't know if anybody has any questions about that strategy, but it works for us.
Any questions for Jen? Thank you for sharing. That's really interesting. I like that. The idea that it gives the PI coordinator and everyone more time on those complex charts, and then being aware of, like you said, I have 5 really long charts and then a couple of ED stays and prioritizing time management. So thank you for sharing. I like that. All right, Shanna. So those 2 were level 1s. And then I wanted to also have a smaller facility. So Shanna and Daphne do the registry for Mount Graham. Shanna, are you on?
Yes. Can
Okay.
you hear me?
Yes.
Okay, perfect. Yeah, so our system is a little bit different because we are smaller. So Jen and Maria sound like, they're larger centers. They have more staff, more to kind of manage, I guess, day to day. But I'll just kind of explain how we do it here. So how we track our patients, or how we know which patients need to go into the registry. We have a report that's built in our computer charting. We use Meditech. And so we get a daily report every day of trauma activations. And then we can also go back and kind of run like a month long or a couple months or however long we want to report. And it captures based on the trauma flow sheet being scanned in. And we use a trauma flow sheet for every trauma activation. It doesn't matter which level. And so if that's scanned into the chart, and or if the nurse chooses which level of activation, whether it was a red, yellow, green, then it will populate to that report. So that's kind of how we find out the trauma activations. And then I have a nurse that helps out, and she looks at the daily summary report every single day to catch any of those missed traumas that weren't trauma activations, but they have injuries that meet the registry criteria that need to be entered in. So those are kind of how we identify the patients. Just starting this year, back in, I don't know when, Daphne, I don't know exactly when you were hired, but starting this year, I got a full-time registrar. I had never had one before. So it was kind of split between me and a couple other nurses. We did both the chart review and entered the patients into the registry. And that was kind of back when we did the reduced data set. But since we, became a level 3 and had to do the full data set, I was able to get a full-time registrar, which has been so helpful. And so Daphne enters in all of our patients, except the missed traumas. So if it was a patient that needs to go into the registry based off some other criteria, but they were not a trauma activation, then I enter those in. And I like to do that just to kind of keep familiar with the registry, like know how it works, kind of keep my foot in the door that way, because I don't want to totally lose how to enter in patients. So that's kind of how we divvy that up, but Daphne does it all, and she does a really great job, and we're pretty up to date. I was looking at it, and I think we have all of September done. So, and then we just have a spreadsheet that we keep track of all of these patients, and Daphne and I can communicate back and forth if there's questions about the chart, or if she needs some help with certain things, or help, I don't know, just different things. If there's ever any questions, we can just communicate back and forth on a spreadsheet. And then when it comes to the trauma billing, that report that I mentioned that we get, that we can run kind of every month to show our patients, we were able to get somebody in IT to include the hospital charges and reimbursement. So that's how we get that data and can enter that in. And then we usually kind of go back and enter that towards the end when the reporting is due, because, the hospital charges and reimbursements, sometimes lags or takes a little longer. So that isn't quite as same time. And then for PI, I haven't really used the ESO registry a whole lot other than like it shows the complications, but I do all of the PI review for admissions, transfers, deaths, pediatrics, anything kind of like that. But the ED activations, discharge home, I have 2 nurses that help with the chart review on those. And so our PI is, I guess, kind of separate. Yeah, that's our workflow. That's how it works here. It's Daphne and I mostly, and it works out really well.
Awesome. Any questions for Shanna? All right. Thank you 3 for sharing. I think, overall, if any of you don't have like good solid reports to help you find your patients, I would highly encourage you to work with your IT team to try to get those built. I feel like it would make your life a lot easier. And if any of you have questions, or you feel like there are some kinks to your workflow and you'd like to talk to someone to get some more ideas, I recognize this isn't the the best platform, but reach out to me or reach out to a facility that you work with to try and kind of get some ideas going, because finding the patients and having a good workflow makes data entry a lot less painful. So any questions before we move on? Okay, thank you again to you three for sharing. All right, so miscellaneous. I know that we went over this a little while ago, but there have been some updates to ICD-10 codes and additions. So we had talked about this at our STAB meeting because we wanted to track it. That's just the State Trauma Advisory Board. You all didn't need to be there if you're thinking you missed a meeting, but we wanted to make sure that we had this info out there. So as far as using e-codes, these are the ones that we have for e-scooters, e-bikes, or segways. And I'll share this with you guys so you have it. And we also have the position in vehicle, so you can use that to capture it. But I think that the e-bike one is pretty new for IC10. So in the past, we had to kind of figure out creative ways to capture those, but those are there now to use. Also, I sent out an email almost a month ago now, and it was talking about the ASTR user agreement. So it's a bit of a new process that the state needs to have a user agreement in place with anyone using our registry, for all registries across the board, not just us. But so if you haven't filled that out, it needs to be filled out by October 10th. And as my email had said, it's anyone who uses either the ESO patient registry, or for those of you who don't, if you log into the repository and use that to submit data to the state, then you'll need to sign that as well. So if you have any questions on that, or if you haven't filled it out, please fill that out. And yeah, any questions? Okay. Then now, okay, let's see. Okay, if you can just keep me posted, those of you who are waiting for legal, so I can be in the loop and know when to expect that, that would be great. Okay, it's very similar. Those of you who, back when SFTP were, we use SFTP to send in your files, those two forms, like the user agreement and it's very, very similar to those. Okay, so those of you who don't use ESO patient registry, or you don't submit data, if you want to hop off, this is the portion where we're going to kind of lean more heavily into the ESO patient registry. You're more than welcome to stay, but just so you guys know. Okay, so as we all know, it's been a little painful submitting data first quarter. I've met with most of you individually. We've worked through a lot of the kinks. And I'm hoping that moving forward, the next quarter will be less stressful because we worked out a lot of those kinks. But I wanted to go through it because it's a totally new process and a lot of you had questions, rightfully so. So I'm going to just kind of go through and show you, if you haven't submitted your data yet, most of you have, but what to expect and what it should look like. Okay, so let me share this. All right. So I'm just going to log into a dummy account. So there isn't any patient data. Can you guys see? Yep. Okay. Okay. So the first thing you need to do is create your file that you're going to then submit to the repository. And so you do that in the registry. And then you click on the registry tab, and then this little green box right here. Okay. And then you go ahead and click on create new. This will always say trauma, so you don't have to worry about that. So say you're doing second quarter. So we're going to go to April and then till June 30th. Okay, this is really important right here, this submission organization. So this is the dummy system, so it has a bunch of random stuff like Missouri, but make sure you're selecting the right date as well as the right data set. So I'm going to go ahead and just select 2025 Arizona full. And then don't click unlocked, because if you select records that are unlocked, the chances are they're going to flag and it's not going to validate, and all of your records should be locked before submission. So you click generate file. I'm not really going to do it because it's not going to be helpful. There's already files created, but you generate it and then it'll say pending, and then it'll say processing, and then it'll say either file created with errors, or you'll get a little green check mark. I don't know if this dummy system has a little green check mark because the data is all wonky. But if you get the little green check mark, you're good to go. You're going to go over here and download once you have the little green check mark. But if you see this file created with errors, you're going to click on that. So this, again, dummy system, the errors will populate down here. And what it will have is a link to the patient and then the message of what the error is. So then you would click on open in separate window, and then it's going to pop up all of the issues with your records. Because again, dummy system, you're not seeing that. But I think I have a hand. Jennifer, go ahead. You're muted if you're trying to talk. Okay, maybe you raise your hand on accident. Let me know if you have a question. Okay, so when you see those errors, you just work your way through the list. And if there's anything weird and you're not sure what the error message is referring to, you can reach out to me or ESO, and they can, or they can direct you and tell you what is going on. And if it's something that needs to be fixed, that's not making sense, we can get a ticket into ESO. So that is the first step. So once you have that little green check mark, you've worked your way through the file, created with errors stuff, you're good to go. Go over here, download. Once you download it, it's just going to pop up where your downloads go. You don't need to rename it. You don't really need to mess with it. It's good from there. So after you have successfully created your file, you're going to go back to, let's see, I don't have a repository because it's a dummy account. All right, so let's see. Okay. One second, let me stop sharing. Let me pull up another account. It's not going to show any data. So Shanna, I'm going to use your guys' account just so you know. But it's not going to show any patient data. I want to show them what it'll look like, and I don't have it on my dummy account. Okay. So it should look like this. And if you've logged in and you don't have the repository link, it's because your account permissions need to be changed. So either you or whoever is an admin at your site can go into PM and add you as a repository user. So you have that file, click on repository. It's going to auto bring you, oh, the EMS went away. So if it's stuck on EMS repository, just click on trauma. So you can see here, you're going to see the name of your site, where it's being submitted to, the call for data time frame, and then you're wanting this little accepted. It shows you the number of records and the number of records with errors. So if you see down here, they had 4 errors. I'm not picking on them. Everyone has had errors. Totally fine. So I'm going to show you how to submit data. So you're just going to click on this, and it'll there won't be a drop-down list of all of the sites, so you can't accidentally submit it for the wrong facility. Just select your name here, trauma. Okay, so this is another important one. So make sure you're selecting the right date and the right quarter, as well as the right data set. So I would pretend Q1 2025 full data set. Next step. Okay, this is where a lot of people have gotten hung up. Totally fair. So ESO put this quarterly data submission form right here with the big download button. That's just there in case you guys need the data submission form and you've misplaced it, you need a blank form, you can download that there, but that form will still just get emailed to me. You don't upload that into the repository. So continue doing what you've been doing with the data submission forms. So don't put that into this box right here. So what you're going to do is you're going to browse files. I'm not going to really do it, but browse files, and then it's going to bring up your downloads, and then just bring that file you just did and put it there. Once it's been successfully uploaded, it'll list the file right here. And then it will also give you a little section for notes. So a lot of you have had to do monthly instead of quarterly if you have a pretty high volume. I'm working with ESO to fix that because I don't want you to have to do monthly, but as for right now, you can put like January 2025, whatever. If there's any notes you need to include, corrections, anything like that. And then you're just going to submit and validate. I'm not going to really do it. And then, so you're going to either see accepted or rejected or like a system failure. If the system failure thing pops up, chances are you've either entered in, like say you submit a reduced data set and you accidentally selected full, it's not going to accept that. Or if you have, it's too big of a record. So those of you with a higher volume, if you see that, chances are you have to break it up into smaller files. So they see here that it's 0 records with errors accepted. That's what you're wanting. But in the event you get rejected, this number 4 right here is those 4 charts are what you need to look at. So you're going to go over to this drop down and you're going to download the report. So I'm going to show you what a report will look like. Let's see. Let me figure that out. Let me share my screen. Okay. Let me figure out which one that was. Okay. I'm just making sure I'm sharing the right one. Okay. So if you look here, so this is showing records with warning, records with errors, and records with no errors. Again, everyone has had errors, so I'm not picking on anyone. So the errors are what you need to focus on. They are the things that need to be fixed for you to submit your data. So you're going to look, this right here is the patient ID, and then facility ID. It's not populating correctly right now, so I'm working with ESO to get that fixed. So don't worry if it says no patient or no facility ID. What you need to pay the most attention to is rule ID and then error message. So this one is saying your system access, whatever you've selected, is not working. So you're going to work your way through this list and fix anything there. So down here, you're also going to have warnings. You can disregard those for now because a lot of you have probably noticed, some of you have like 20,000 and they don't make sense. I think I've already mentioned this, but I'm working through those with ESO so they can remove the ones that shouldn't be populating. So that is what your error log will look like. Okay, what else did I want to go over? Let me share this. So once you've fixed all of those, you're going to need to go in and make your file again in the repository or in the registry section, and then upload it, and then it'll give you the little green check mark, hopefully. So if you're having any questions on errors that you're seeing, reach out to me and we can meet and figure it out. Okay, I'm going to go ahead and go back to my dummy system. Okay, so a lot of you have noticed that the error log report gives you the patient ID and you can't search by patient ID. Not very helpful. I've already brought this up to ESO and they said that they're in the process of rebuilding kind of the search bar for the patient registry. So it will include that, so it's searchable. In the meantime, if you have a lower volume, you can just go look by the arrival date because that is included on the report. But there's a report that I've been showing people that I find helpful. So it's called TQIP submission list. So if you go into Insights, look this up. What it does is it shows you all the patients. It's originally for TQIP submission, but you can use it for the state data. So make sure right here on the right, the filters. If you're working with first quarter, you can put in first quarter. I have a hand.
I can't see your screen.
Oh, thank you, Shelly. All right. Are we good?
There we go.
Thank you. Okay. TQIP submission list. This is a report, but it doesn't, you don't have to use it for only TQIP records. So right here on the right is the date range. So you can change that if you're working on fixing first quarter, second quarter, you get the gist. And then down here, the submission organization. So you can just select Arizona full, Arizona reduced, whichever patients you're looking at. Why this is helpful is because it then gives you the link to the chart directly. And you can go here. It only lists one patient because this is a dummy system. But if you click on this, it will sort from by date. So you can use your log to look at date, and then it's a lot easier to find the chart. And then it directly links to the chart instead of having to kind of fish around just by arrival date. You can click on this. It'll take you directly to the chart, and you can fix whatever the issue was. Okay, let me make sure. Okay, does anyone have any questions on any of that?
Where did you get into the into that? You just go into the TQuip and it'll pull up that screen right there?
Yeah, so if you go to Insights and type in TQuip, you should see these two options. You're wanting the TQuip submission list. If you only see TQuip list non-PI, this one won't work. And that means your permissions need to be changed. And I'll show you what needs to be turned on. So go into PM, open up your account, go to account, security roles. Okay, so this Insights patient registry with PI, if that's not selected, you're not going to see the report. So that will need to be turned on. Okay, so go back here. So yeah, Insights, TQuip, and then you can utilize this TQuip report so that you can pull up all of those patients, and it makes it easier. Any other questions? Okay. And I have some appointments with several of you still to go over your data submission, so we can still look at that. Maternity leave notes. So as you all know, I will be leaving on maternity leave in the next 2-ish weeks. So we've already gone over the big things that are going to happen while I'm gone are your third quarter data submission, which is due on January 2nd. There will be some emails that are coming out or that I've scheduled to remind you to submit your data. You're going to send your email or your data submission form to Ann Bosbrink. Here's her email. I've also put together a pretty massive email with all of this information, as well as a lot of PDFs that I think will be helpful to you guys. So you'll have all of this, and I'm going to send that email out to you. But again, send her your data submission form. She'll say, thank you for sending in your form. And then when I get back, I will validate data, look at, my side of validation, and then sign it and send it back to you. If you're having any issues with the repository with submitting data, ESO wants you to submit like support tickets versus using that email we've been using. So this is a link to that form. The other big change is your 2026 registry template. So once 2026 hits, you need to have a separate template for your 2026 patients. So this is for those of you who use the ESO patient registry. So what this does is any changes for 2026, whether that be NTDB or the state, you use that template to reflect those changes. But while you have that template, you can still finish out 2025 charts. So I'm going to go over how to build a template real quick, so you guys have that. Okay, let's share. Okay, so you're going to go ahead and click on registry. And this only needs to be done, one of you need to do this. It doesn't need to be done by everyone at your facility. So just one person. So go ahead and click on the little wrench. So you can click on add new. And then I'm just going to do test because I'm going to show this. The specialty, you can't fill it in, just ignore that. You're going to want to go to January 1st, 2026, and then you're going to create the template. I'm not going to really do it because I've already created one to show you. So what that does is you'll see right here, this says future. So it's 2026 Arizona full data set test. So make sure and label it very clearly so you guys it doesn't kind of get confusing of what you're looking at. And it starts January 1st, 2026. It's unpublished, but you'll want to make sure and publish it. So this, you can still work on these charts. This will just reflect any charts that come in for January 1st onward. So go ahead and hit actions and view. So the only thing you really need to do is, so for this org submission, you're going to scroll down, and the 2026 update is not out yet, but ESO has said it will be out by then. Fingers crossed. But you'll need the 2026 update to be turned on to reflect for those records. So you'll scroll down, pretend like this says 2026. So Arizona reduced data set 2026, you'll turn that on. If you're full, you'll look for full. And then if you are an NTDB site, you'll also turn on the NTDB TQIP 2026. So once you make those changes, you'll go ahead and publish it. And then you'll have that template ready for your January 1st records. Let's see. And I've also made a video of me essentially doing that same thing that I'm going to send out in that email. So when it comes around for that time, you guys have that for reference. Any questions? Okay. Let's see. Okay. Miscellaneous. Yeah, TRUG will be canceled because I will be probably maybe just coming back from maternity leave or still on maternity leave. And then if you have any questions that are related to the registry, again, put in a support ticket with ESO. If you have any very specific like state questions or Bureau of EMS and Trauma Systems, you can reach out to Anne and Julia, but they're not going to be able to do any of like the ESO patient registry backend stuff. So reach out to ESO with any registry questions. And they are where I will be. They should help you. No. So you'll need to if you want to email me and let me know, like, are you talking about leaving from ESO to a different registry for all your sites? Okay, so let's chat and email me so that I can make ESO aware of that before I leave, so that you can have a contact to work with at ESO. Does that work? Great. Okay. Let's see. And again, as I said, in my email, I have a lot of different PDFs that show different topics that are usually helpful, as well as the PDF of the facilities with all their IDs if you need to add a hospital to your pick list. And then if you need any registry stuff, you can use a little resources tab for ESO for as far as like their education they have. Any questions? Okay. Okay, so I wanted to touch on pick list changes. So I wanted to make sure everyone knew that when you go in and make changes to your pick lists, charts that are already locked will not reflect any of those changes. But if your charts are unlocked, then they will reflect those changes. So if you're needing to make a change, you need to make sure that your charts are locked versus unlocked, depending on what you're trying to do. And I also wanted to point out, those of you who have submitted data, you recognize this. If a pick list option isn't mapped to a state pick list option, then it's not going to be accepted and it's going to flag. So make sure that your pick list options you have turned on are either mapped appropriately or they're state pick list option. For your hospital pick lists, just a name change, Honor Health Mountain Vista is now Honor Health Four Peaks Medical Center. And then I wanted to highlight, we've changed this on pretty much everyone's, but make sure your system access pick list options are correct, because a lot of you are getting errors because there were pick list options turned on that are not accepted. So you should only have pick list options like 5 through 8 turned on when and those of you who are familiar with your template. I've worked through this with a lot of you already, but if anyone has any questions, let me know, but just triple check that those are the correct options you have turned on. All right. I already went over that. I had it twice. Okay, I wanted to go over how to share reports again and insights because I've had quite a few questions on that. All right. Okay, so the first thing you need to do is go into PM and then click on, if you're trying to give someone else access or yourself, just depends. Go to account, edit. So what you're looking for is this Insights Dashboard Community User. So in order to opt in to receiving reports from people or sending them, you need to have that selected. So it is on. And then the next step is to go to Insights. You're going to click on this question mark down here. Click on Resources and then scroll all the way down and opt in. And then you will see this. And it's basically saying you're aware that you're sharing a report, but just for awareness, you're not sending your data to anyone. You're just basically sending the outline of the report that you've built. So you're not sharing data. Click that, activate dashboard community. Then you'll get this little green thing. But just so you know, it takes like 15 minutes for this to kind of take place. But once it does, how you share a report, she'll go to Insights. Go into a report, and then this little, I don't even know what to call it, next to the PDF button with the little 3 circles, sideways triangle thing. You're going to go ahead and search for a person. Why isn't it working? Okay, so whoever you're looking for, like for myself, if you're ever sharing a report with me, I have multiple accounts for different facilities so that you have to check that you're sending it to the right facility over here. But make sure the name's correct. You'll select their name and then you'll hit republish, and then that will share the report with them. So if you have any questions on that, reach out. Okay. I think that is all I have. Any questions for me? Brian.
On my ESO dashboard on the front, there's no option for the PM. Is that a accessibility issue or like a permission?
That would be a permissions thing. So whoever's your admin can go in and make you a PM manager or a user, so that you have access if they want you to have access.
Copy that.
Actually, I think I can change that for you.
Yeah, I thought that it was upwards of you, but I was gonna.
Yep, that's me. I had to think. I was like, where are you at? But I can change that for you.
Awesome. Thank you.
Any other questions for me? Maria.
It's trauma one still going away like December 31st, like you had said before?
Yes.
Like access, yeah. Is there any way to have a little more time? Like I'm just saying, like when we go through our TQIP benchmark, I still go in there just to make changes sometimes, and I resubmit old records.
Mm-hmm.
Do you think they'll let us keep it like maybe 1/4 of 26?
As far as everything they've said, they're not going to support it past then. But that being said, the sites that don't use the ESO patient registry who are desktop are able to finish out 2025, so they would have access, but theirs is different because they're not, because they're desktop. I can ask. I don't know what they will say, but I can ask them and see what they say.
Thank you.
Well, not necessarily, because it's still hosted. Like they still host it, and that data is still the site is essentially still supported, if that makes sense. Okay, Carrie. So the data submission is still in the works, or the data migration. So the thing that ESO has told us is that the data is not going to be in ESO. We will be able to give you your data and you can have that in a program, but it won't be available in the ESO patient registry. There's not a way to import it so that it's available to report on, if that makes sense. Maria, I will ask, let me make a note. Okay, past 2025. TQuip. Okay. Janelle, yes, and that's because you guys have you're not web-based. So the web-based versus the desktop are different. You guys as desktop users support your own trauma one. It's not supported web-based by ESO. Does that make sense? Okay. All right. Okay, that's all I have. Anyone has any other questions? Okay. Thank you all for your participation. Feel free to reach out if you have any other issues or questions. Yep. Thank you.